In Health Watch, today is World Pancreatic Cancer Day. People around the world are raising awareness about one of the world's toughest diseases. It is the third leading cause of cancer-related deaths in the United States and has a 5-year survival rate of just 10%. Among Americans, it's the 11th most commonly diagnosed cancer. So Julie Fleshman joins me now. She's the CEO of the Pancreatic Cancer Action Network. So glad you are here with us, Julie. As you know, November is also Pancreatic Awareness Month. Given the awareness around this disease, some people do not consider how important it is to get regular checkups. There's this idea that pancreatic cancer just sort of like comes out of the blue and you know, there's hardly any symptoms and there's nothing you can do to sort of avoid it. What should viewers know about this cancer and who's at risk?
Yes, thanks so much. So while there is no early detection test for pancreatic cancer, we certainly want people to be aware of the risk factors and the symptoms for the disease so that they can be their best advocates when they go to their doctors. So some of those risk factors are things like age, smoking, being overweight, pancreatitis, diabetes, and we also know that about 10% of people are diagnosed with pancreatic cancer because of an inherited mutation. And just because someone in their family has pancreatic cancer doesn't mean other family members will get it, but it's still really important to understand your risk. And then some of the symptoms are things that are very vague, which is why some people don't always pay attention to these things. Things like stomach ache, back pain, unexplained weight loss, new onset diabetes. And people can go to pancan.org to read more about all of the risk factors and symptoms of pancreatic cancer.
So, Julie, what are some of the most effective treatment plans to help and manage and beat the disease? With many cancers, as you know, early detection is key. But if there isn't a way to detect pancreatic cancer until it's too late, how do you get around that?
Right. So while there isn't an early detection test, once someone is diagnosed, there are treatment options. And that's an important message. People should not be told by their doctor that they should go home and there are no options. There are many clinical trials, lots of research being done for pancreatic cancer, many clinical trial options for patients. And sometimes that is the only way we will find new treatment options for the disease, and often is the very best option for patients. We also now know that when someone is diagnosed with pancreatic cancer, they should get both genetic testing and biomarker testing of their tumor. And that information could provide the doctor with the best treatment option to match whether their genetic mutation or the genetic mutations of their tumor. So we are learning more about how to best match the patient with the right treatment, and we just need to make sure people are informed.
What is it that makes pancreatic cancer so challenging? Is it primarily because often it's not detected early, or are there other reasons?
Yes, certainly not having an early detection test is an important factor. Usually by the time it's diagnosed, it's late stage. Your pancreas is located deep in your abdominal cavity, so it's behind your stomach, in front of your spine. And I once had a doctor tell me if you were going to hide something somewhere in your body, you would hide it in your pancreas. So it sort of gives you the visual image of why it's hard to detect. It's not something we can feel like, you know, a lump on your breast. So it's not something visual to the eye. But we also need more research dollars. This is a disease that has been underfunded, and we need people to donate so we can continue to fund more research. But I am proud to say that there is a lot more going on in this field today, and we continue to make new advances and new progress every single day.
So when you what are the families? Are they dealing with this? People who are diagnosed within their own families. I would guess that if you have a family member who is diagnosed with pancreatic cancer, you'd be pretty nervous that you might also develop it.
Yes, I mean, I think that is definitely a fear a lot of people have, and it's important to understand your risk. And there's actually new information now that recommends that first degree relatives of a pancreatic cancer patient, so a mother, a father, a sister, a brother, or a child of someone who has had pancreatic cancer, should consider talking to a genetic counselor to better understand their risk. And that genetic counselor will help that family look at their family history of cancer and where pancreatic cancer falls in that, and whether getting genetic testing might be the right thing for that family. So we absolutely recommend that families understand their risk. At pancan.org, you can also find a family history worksheet that could help a family fill out that information to then go have a conversation with a genetic counselor.
And how much can genetics tell you? I think like sometimes people think that, you know, you kind of look at your genetic makeup and it's almost like you're kind of reading a script and you get detailed information. I guess there are some things that you can sort of count on and some things that you can't. I imagine now there are people that are going through their family tree and they're thinking like my third cousin once removed may have had pancreatic cancer and sort of starting to panic. But what can genetic stuff tell us?
Right. And again, the recommendation is just for first degree relatives. So it is not for people deep back in your family history. And the information that you get from genetic testing does not tell you that you will get something, that you will get pancreatic cancer. It just lets you know what your risk is. And if you know your risk, you can then be vigilant. You can watch for the symptoms. You can watch for the things when you aren't feeling well. You can be your own best advocate. PanCan believes that knowledge is power. It puts you in the driver's seat of your health.
That's so true. That is like, I need to tattoo that someplace. It's just good advice. Julie Fleshman, thank you so much.
Thank you.